Hi everyone, this is Michelle Grosvenor from Associated Psychology Practice, and I hope you're having a great day today. Today I just wanted to share some information with you about tics and Tourette syndrome. So for many people we've heard those terms, but you might not know what they mean. So in pretty simple terms, a tic is an involuntary movement. So it's a movement that our body makes without us intentionally setting out to make that movement. So in some cases, the movements or of vocalization can occur exactly opposite to what a person might want to do. So some examples of tics, of a movement-based tic, could be that people might have a facial twitch, maybe blinking. For some people, their neck might make a jerking motion, or their shoulders might shrug, or their arm might move out involuntarily. And those sorts of tics can, in some situations, cause embarrassment and distress to individuals. Motor tics and vocal tics, they're actually relatively common in children. So about kind of 12 to 18% of children under the age of 18 might experience at least one tic at some point in time. But for most of those children or young people, it just happens, and might happen for a little while and then stops happening. Just going back a step, I realised I didn't explain what vocal tics are. So vocal tics are, as you would imagine, something that involves a noise coming generally through your throat, although sometimes it can involve your nose as well, such as sniffing noises, coughing when you don't have a cold, but it's very recurrent and can be quite loud. For some people, they might say words randomly that are not connected to what they're talking about or the conversation, and so that can be quite distressing or upsetting. So for some people, those tics do involve swearing, but that's actually really uncommon. So I know in the media, when they show someone with tics or Tourette syndrome, they often will have someone who's swearing or making rude hand gestures, but that's really uncommon. Only about 10% of people with tics or Tourette's ever experience that kind of symptom. So it's more likely just kind of normal everyday movements, but just kind of or things that are not offensive, but which are involuntary. It's not a behavioural issue. It's not attention seeking behaviour or attention needing behaviour. It's a neurologically based disorder. And so basically what that means is that instead of your brain filtering out unnecessary movements or vocalizations, your things that would normally get caught by a part of your brain called the basal ganglia, they go through. So essentially there's been a bit of confusion or mix-up in someone's brain when they experience tics. So we've got a part of our brain, the motor cortex, that controls, stores memories of how to make a movement. And each movement has its own kind of neuron and pathway, and we have a part of our brain called the prefrontal cortex, which is supposed to set the rules for when a movement is necessary or appropriate. But sometimes what can happen is that it gets mixed up, and so instead of kind of going, I don't need to make that movement, your brain just kind of lets it slip through, and then things in the environment can reinforce that movement or vocalization reoccurring. So for example, if people make a lot of comments about it or tell you not to do it, it actually that registers with your prefrontal cortex, which is the part of your brain that sets the rules, and it's a bit indiscriminate. So instead of going, oh, that was negative attention or a negative response to the tic, it just goes, oh, that, there was a reaction to that. So it doesn't actually evaluate whether it was a positive or a negative one, and it just increases the strength of of the connection between, increases the likelihood of that recurring again, to explain it in that way. And so for someone to be diagnosed with a persistent tic disorder, it means that they're experiencing at least one or more tics, which are either vocal or motor tics, that have had an onset at least 12 months ago. So they've been happening for over a year. Doesn't mean that they've happened throughout the whole year, but they've just occurred there. For someone to be diagnosed with Tourette syndrome, it basically means that they've experienced both motor and vocal tics for a period of greater than 12 months as well. And likewise, it doesn't have to have been occurring for the entire period of time, but that the onset was at least 12 months prior. So the good news is that there are really effective treatments out there for tics when they're required. So in most cases, tics can just resolve on their own, but for those people who the tics continue on, there are some interventions that have a lot of research behind them to show that they're effective. So two of the psychological interventions that are evidence-based are exposure and response prevention treatment and comprehensive behavioural intervention treatment for tics and Tourette syndrome. So the one that I'm trained in is the comprehensive behavioural intervention treatment for tics and Tourette's, and both the ERP and CBET have been found to be equally effective. However, some of the research is indicating that CBET actually shows results quicker, which is what most individuals and families want. And so CBET, which is the comprehensive behavioural intervention treatment for tics and Tourette's, involves increasing awareness. So that involves a lot of education about the neurological basis of tics, about things that can increase the likelihood of tics recurring, and about the sequence that a tic might occur in, what it's like for the individual. And it's a really important part of the treatment, is increasing their awareness so that we can look at, in some cases, alternative competing responses. So basically that means teaching people things they can do that physically stop them from being able to for their body to carry out the tic. So say someone has the urge to raise their arm and it's an involuntary tic, so say that's their tic. A possible competing behavioural response might be to get the person to put their other hand against their arm, pressing it down so that they're unable to complete the tic. And so it involves tensing up the arm and being able to do that for a long period of time if necessary until the urge passes. Apologies, my phone's just going in the background. And so they're the kind of, it's a really kind of exciting type of treatment because it's very collaborative and interactive, where the therapist and the individual with Tourette's and sometimes their family, if it's a child or young person, are there learning about ways to change the way their body responds when they get that signal. So if you or someone in your family might benefit from finding out more about comprehensive behavioural intervention treatment for tics or Tourette syndrome, please feel free to contact the practice on 9... I'm having a mental blank about our phone number. I'll just check it for 1 second. I think we all have those moments. So 96223137, or check out our website. And at the moment, I'm the only clinician currently trained in CBET at the practice. So please, if you're wanting to find out more about that, I'd recommend that you specifically ask to book an appointment with Michelle Grosvenor. So I hope you found this information helpful. If you have, please feel free to like, share or comment. And thanks for your time today. Bye for now.